Let's understand multiple myeloma. It is transformation of a single clone of plasma cell producing single type of immunoglobulin. It can be either G, most commonly it is IgG. It can also be IgM also and IgA also. Now, what are the characteristic feature of this multiple myeloma? So, there occurs anemia. This is because the bone marrow is occupied with abnormal cells, especially the precursor cells of immunoglobulin, that is the plasma cells, and this will interfere with the erythrocyte production, resulting in development of anemia. Apart from that, the second clinical feature is spontaneous fracture of the weight-bearing bones. This is because of accumulation of this precursor cells, that is abnormal plasma cells, and these can involve ribs, vertebra. And when X-ray is taken, it shows the presence of punched out osteolytic lesions. Because of this spontaneous fracture, what happens is the bone matrix is broken down and calcium is released into circulation, resulting in hypercalcemia. So the serum calcium level in these patients is always elevated. When it exceeds the capacity of the general circulation to hold this calcium, it gets excreted in urine. So calcium is also seen in urine. So another characteristic feature of multiple myeloma is Bence-Jones proteinuria. Now these Bence-Jones proteins are monoclonal light chains which are excreted in urine. Now this there is in multiple myeloma there occurs asynchronous production of immunoglobulin light chains and heavy chains, and these Bence-Jones proteins are usually light chains which are excreted in urine, and during their excretion they can block the renal tubule and predispose the person to the development of renal failure. Now the characteristic feature of Bence-Jones proteins are that they precipitate at 60 degrees centigrade, and with continued heating, especially at 80 degrees centigrade, they redissolve. This is one of the characteristic feature of Bence-Jones proteins. So when the serum sample of this multiple myeloma patient is subjected to electrophoresis, so there occurs expansion of the gamma globulin, because there is increased production of gamma globulins, and characteristic M band is seen in the gamma globulin region. Apart from that, there occurs amyloid deposition in the liver and kidney, and these deposits are made up of variable regions of light chains of immunoglobulin, and this is known as AL type. So special stain called Congo red stain is used to identify this amyloid deposit. Coming to other paraproteinemia, multiple myeloma is a paraproteinemia. So coming to other paraproteinemias, Waldenstrom's macroglobulinemia is characterized by malignant transformation of plasma cells, which produces mainly IgM immunoglobulin. Now, as you all know, this IgM is a macromolecule made up of 5 subunits joined by J chain. So they form cryoprecipitate, and this increases serum viscosity and predisposes the individual towards development of recurrent bleeding. Next type of paraproteinemia is hypergammaglobulinemia. As the name suggests, there is increased production of immunoglobulins, and these immunoglobulins are polyclonal in nature. That means it can be there can be synthesis of IgG, M, E, A, D, and these immunoglobulins are production is increased in any chronic infections like tuberculosis, leprosy, and rheumatoid arthritis. In the other end of the spectrum, we have hypogammaglobulinemia, where there is decreased production of immunoglobulins. It can be either primary or secondary. Primary, there is completely no synthesis of immunoglobulin seen in Bruton's disease. Secondary is there is loss of immunoglobulin production is normal, but the immunoglobulins are lost through damaged glomerular capillary membrane, where the podocyte size is increased. So these immunoglobulins are lost in urine in nephrotic syndrome, and there is decreased production of immunoglobulin as seen in leukemia. So this was all about multiple myeloma. So thank you, happy learning. Next video is on vaccine development. Please do like, share and subscribe.